Welcome to the ONS podcast with your host, Linnea Jacobson.
Welcome, audience. Welcome back to our ONS podcast brought to you by our partners at Face to Face Academy. ONS stands for Office of Neighborhood Safety. I'm your host, Linnea Jacobson, and I work on the ONS team. We created this podcast for departments like ours and community organizations to come on and talk about our services. All of the episodes are about connecting you to alternative public safety measures, programs, and your local growth and healing opportunities. Today, our topic is Feeding St. Paul with an organization called Open Arms. Open Arms was started in the mid-'80s by a compassionate individual named Bill Rowe, who began cooking meals from his apartment and sharing these meals with his neighbors who had become too sick to take care of themselves after falling ill to HIV and the AIDS virus. After becoming a big deal, his business was formed into a volunteer organization, acquiring large buildings and spreading across Minneapolis and St. Paul, delivering meals to numerous at-home patients who were bedridden with sickness and disease since the 1980s. Today, we are so lucky to have Leah Hebert Welles here in the studio with us. Welcome, Leah.
Thank you. Thanks for having me.
Leah is the CEO of Open Arms and has been leading since 2013. Oh
yes, it's not a typo.
I read it right. Ms. Welles has spent 20 plus years of her career working in the nonprofit leadership positions. She's worked in arts, community education, and reproductive and community health care. She began her career out of college as a victim advocate at a battered women's shelter, which ignited something in her to want to serve community, making sure the underserved and the vulnerable populations have access to justice and resources. Becoming a mother at the age of 17, she has felt what it is like to be vulnerable and need resources and community services in order to survive. So she is committed to the work and paying it all forward. She has served on a variety of boards of directors and community coalitions and currently serves on the advisory board for the Food as Medicine Coalition, as well as the board of Ford House, a home for people living with HIV and AIDS. Thank you, Leah. First of all, I just want to say, I appreciate your intro, being so vulnerable when I read about becoming a young mother, because I too was a single parent young mother, and just putting yourself out there and saying, hey, I'm human, this happens, and this is why I understand the work and I know the work and this is why I'm passionate about it, because this was me at some point and I needed this. That's huge. A lot of people don't do that. So give me a 30-second spiel about yourself that I haven't already read.
You've kind of covered it all. So like you said, I've been at Open Arms for quite some time. I've been there for about 11 and a half years, and we've grown a lot. But I think what you just said really resonates when you are young and when things happen in your own life and you have to ask for help. It's impactful. You know what it's like to be treated good when you ask for help. You know what it's like to be treated badly when you ask for help. And so for me, that was really a driving, movement forward, where I took my own experiences and started working in nonprofits and wanted to make the world a better place for other people.
Well, thank you for serving. I always start off with icebreaker questions.
Okay.
So I'm going to ask you some questions that were not on the list that I gave you, but
great.
Barbecue ribs with sauce or without sauce?
With sauce, definitely.
Do you have any pets?
I do. I have 2 big dogs.
All right. So which statement best describes you? My dogs are a nightmare and too unpredictable, or I just want to be at home snuggling with my dogs.
Oh my gosh, no pressure. I would say I fall somewhere in the middle, but I'm going to go with my dogs are a nightmare right now because they're shedding everywhere.
Oh my gosh. What kind of dogs again?
Well, they're long-haired kind of mixes, a Great Pyrenees mix with some other things. So they're very big and they bark a lot, and they're shedding right now, which makes no sense because it's cold.
Okay. And are they all over the furniture?
100%. Yeah.
See, that's my guilty. That's something that I do that a lot of people don't. I used to have a dog. Actually, I used to have 2 dogs, and one of them I used to just let him be all over the place. He was on the bed, he was on the couch, and that was during my single days, and I was trying to date, and guys didn't like that, and and there would be fur all over the couch, and family would come over and they wouldn't have anywhere to sit because I'd have fur all over the place. Last question. If I had to do it all over again, I would finish the sentence.
Oh boy. If I had to do it all over again, I would be present more in lots of ways. I would be present more with my kids. I would be present more in the world and my job. I think the world just moves really fast and we move really fast and we try and balance a lot of things. So that's the first thing that popped into my head is I would be present more.
That's cool. Are you the person that's always thinking about what happens next or what you got to do next or tomorrow?
Yes.
Yeah.
Which is good and bad, right? It's a mixed blessing.
No, I feel you. And that's me too. So let's jump right in here to these questions. So tell our audience, who is Open Arms and how did you guys get started?
Sure. So like you said, we were founded in the height of the AIDS epidemic, and folks were, at that time in 1986, folks were in their homes and nobody wanted to come near them. And our founder saw his friends, his colleagues, his students, he was a teacher, he saw them wasting away in their apartments, in their homes. Nobody would bring them food because nobody wanted to touch them at that time because they didn't understand AIDS. And so it broke his heart, and he started cooking in his kitchen and then bringing meals to people in their homes. And at that time, they were, cheesy, buttery goodness. So lots of calories for people who are literally wasting away from AIDS. But second, the thing that was almost more important than the food was the message that somebody cared about you, and I'm not afraid to come into your house and I'm delivering you a message of hope and of caring. Yeah. And that has, even with how big we are now, is still a really important part of the message that we deliver. We deliver meals to folks who have lots of different critical illnesses. And sometimes the most important thing we do is just come in and say, hey, how are you? We care about you.
That's beautiful. Tell us about your team.
We have 90 staff people, but which are great, and they work really hard. They work in 2 different kitchens, and they make sure all of the meals get out the door. And then one of the special things about us is we have about 7,000 active volunteers.
Oh my gosh.
Yeah. So volunteers work in both of our buildings doing all of the meal prep and almost all of our meal delivery. So they're going out every day and delivering meals to about 1,800 clients a week.
Oh my gosh.
So we love those volunteers, and together with the staff and the clients, it's just a great community.
That's amazing. That gives me goosebumps. It takes a lot. How do I say this? A lot of people volunteer, right? People volunteer all the time, but I don't think that people who don't volunteer understand what goes into volunteering. You're not just doing something good. You're carving out time from your life to go serve others. You know what I mean? And that's a
exactly
huge impact.
Right.
So I feel like people say volunteer a lot, but it's like just throwing it out there and saying the word is like, what do I want to say?
I don't know. You're absolutely right. There's something about it that doesn't capture it.
Right,
yeah.
right. It does. That's it. It's not captured. Like the heart that goes into volunteering is really not captured. Just saying, yeah, I volunteer. Right.
Right.
Where are you guys centrally located, and what do you find unique about St. Paul versus the other locations you're serving?
So we've been in the Phillips neighborhood in Minneapolis in one form or another for all those 30 years, or 35, let's say. And then 2 years ago, we built a second commercial kitchen right off of Highway 52 next to downtown St. Paul.
Okay.
And we did it for a couple of reasons. One is that community of volunteers that we had built, we had really built that on the west side, and we really wanted to do that on the east side because we know that sick people live everywhere, and we wanted to build more volunteer community and be able to help more folks on the east side. I would say that what's different about St. Paul is also what's special about St. Paul is that people here are close and the community is very close. And so you have to kind of break into the community in St. Paul, right? And then once you're here and you've proven yourself and people start to trust you, then they introduce you to more folks. And so it's taken us a couple of years, but we're really starting to get lots of volunteers from St. Paul and from the east side, and we're starting to get a lot more referrals from healthcare here. And so it's a great place to be.
The well-known slogan for St. Paul is called St. Small because it's a big city, but it feels like a small town feel. Like everyone knows everyone. You're related to somebody, or you know somebody's cousin, or you went to school with somebody's mom, and it just goes on and on.
I love that.
So yeah, St. Paul is really good. I love St. Paul. How many people do you serve per year, and how can people access your services?
So most people are referred to us by healthcare or social services. So clinics like the one we're sitting in right now and face-to-face, refer folks who have critical illness and probably food insecurity as well. So it's the combination of the two. So all of our clients have some kind of a health condition or critical illness, and then also a lot of them are food insecure or not able to access food.
Okay.
So referrals come from healthcare, they come from nonprofits, they come from all kinds of different social services, or people hear a podcast like this and they say, my aunt has cancer and I need to figure out how to take care of her for the end of her life. And so we get lots of referrals that way too. And we encourage people to call us or check out at the website if that's the case. Definitely try and get a hold of us. We love for people to come in and volunteer and help us out in lots of other ways too.
So the specific requirements are through health. Is that
Yes.
correct?
So
Okay.
all of our clients have an illness, and they don't have to come in referred by healthcare, but we eventually reach out to their healthcare provider because most of them have a special diet. And that's kind of what separates
Right.
Open Arms from, say, Meals on Wheels or another organization like that, is that all of our clients need a special diet, and we make the food in our kitchens that are specific to that diet. So for instance, most of us know if you have a heart condition, you have a lot of salt or cream or butter.
Yeah.
So we have a heart healthy menu where we really control all those things, and we bring food to your house that you need for your specific illness.
That's cool.
Yeah.
That's cool. What drives your passion to serve in this capacity?
You know, in this capacity, I would say I was attracted to Open Arms because I came from community health, and I love community health. I love it because healthcare is hard for people to access sometimes, and I want to break down those barriers. And then when I came to Open Arms, I don't think I fully understood how special food was. And I have learned now through the course of working at Open Arms for 11 years how much we take food for granted and how sacred and special food is to people. Food is personal, it's spiritual, it's cultural, it's everything, right? And those of us who have easy access to it, we take it for granted. And for people who don't have easy access to it, especially when you are really sick and scared for your life, it's really special to have somebody bring you that food.
And that's a good segue into my next question. How does food and nourishment play into the role of alternative public safety measures?
Wow. Well, I think that when you don't have food, there are things that you have to do to survive, right? And so I think that that food is part of a bigger picture around food and housing and having access to your basic needs and all the things that you need to be safe and feel safe. And so I feel like food is an important part of the puzzle. And then working together with other organizations, we can help create safety nets for folks. And so lots of our clients come to us and they need more than just food. And so working together with organizations that provide housing, transportation, that provide counseling and mental health services, all of us together can create opportunities for folks to be safe, truly, and to get their needs met.
Girl, you better say it. How can people volunteer and how can people donate to Open Arms?
Absolutely. Well, it's all on our website, and we love volunteers, and of course, we never turn away donations because it takes all of that to make this possible, just like all nonprofits. So, you just go to our website, which is openarmsmn.org, and click right on the top, and there's ways to sign up to volunteer. You can come in by yourself, you can come in with your kids, you can deliver, you can work in the kitchen. In the summer, you can work in one of our farms, and we'd love to have you.
I love that because a lot of places don't let you bring your kids in.
Yep, we love it.
And I think it's important, especially now in this generation, that our kids get involved in serving.
Yep, I agree. I've got 2 teenagers, and
Yes.
we're working all the time to remember just because you got those pair of shoes doesn't mean somebody else got those pair of shoes.
Amen. What are your goals in doing this work for the community of St. Paul?
I think, my goals are always really lofty, like make sure everybody who's sick gets the meals and food that they need. And so, which we all know is a big goal. And, but that's really it. It's like I want to keep saying yes. I want to make sure that anybody in St. Paul who needs meals, who is sick, who needs help, reaches out and gets help that they need. That's what our goal is.
Thank you, Leah.
Absolutely. Thank you so much.
There you have it, St. Paul. We're out here working hard to rehabilitate, intervene, and rebuild safer neighborhoods. Again, this podcast is about being able to connect with you on alternative public safety matters, programs, and your local growth and healing opportunities. If you'd like to learn more about Open Arms Minnesota, whether that's how you acquire services, volunteer, or donate, please visit www.openarmsmn.org. For donation, scroll to the bottom and you will find an orange button to click on that says donate. And for more information about the Office of Neighborhood Safety or joining the NSCC, check us out at www.stpaul.gov. Click on residents and you will find us under public safety.